Welcome to this video about adrenoleukodystrophy, or ALD. ALD is a rare, genetic disease that primarily affects the brain and adrenal glands. It's a devastating condition, especially for children, and understanding it is crucial for early diagnosis and potential treatment. In this video, we will explore the causes, symptoms, diagnosis, and current treatment options for ALD. The root cause of adrenoleukodystrophy lies in a defective gene, specifically the ABCD1 gene located on the X chromosome. This gene provides instructions for making a protein called ALDP, which is crucial for transporting very long-chain fatty acids, or VLCFAs, into cellular compartments called peroxisomes. Inside these peroxisomes, VLCFAs are broken down. When the ABCD1 gene is faulty, LDP is either missing or not functioning correctly. This leads to a buildup of VLCFs in the brain, adrenal glands, and testes. Now let's delve into the disease mechanism of ALD. The accumulation of VLCFAs is toxic, particularly to the myelin sheath, which is the protective covering around nerve cells in the brain. This damage to the myelin sheath is called demyelination. As the myelin deteriorates, nerve cells can no longer transmit signals effectively, leading to neurological problems. Simultaneously, the buildup of VLCFAs in the adrenal glands disrupts their ability to produce vital hormones, like cortisol, which are necessary for regulating stress and maintaining energy levels. ALD is considered a rare disease. It affects primarily males as they only have one X chromosome. Females with two X chromosomes can be carriers of the gene. Though exact numbers are difficult to pinpoint, it's estimated that about 1 in 17,000 newborns are affected by ALD. Carrier frequency is significantly higher, estimated around 1 in 4,000. The symptoms of ALD can vary widely depending on the age of onset and the specific form of the disease. In childhood cerebral ALD, the most severe form, symptoms typically appear between ages 4 and 10. These can include behavioral problems, learning difficulties, vision problems, seizures, muscle weakness, and impaired coordination. Adrenal insufficiency, also known as Addison's disease, can occur in all forms of ALD and often presents with fatigue, weakness, loss, and skin darkening. In adults, ALD can manifest as adrenoleukodystrophy, or AM, which primarily affects the spinal cord and causes progressive stiffness and weakness in the legs, bowel and bladder dysfunction, and sexual dysfunction. Diagnosis of ALD typically begins with a blood test to measure the levels of very long-chain fatty acids. Elevated VLCFA levels are a strong indicator of ALD. If VLCFA levels are elevated, genetic testing can be performed to confirm the diagnosis by identifying mutations in the ABCD1 gene. MRI scans of the brain are also essential for assessing the extent of myelin damage in cerebral ALD. Adrenal function is evaluated through blood tests that measure hormone levels like cortisol and ACTH. ALD presents in different forms. Childhood cerebral ALD is the most aggressive form, characterized by rapid neurological decline. Adrenomyeloneuropathy, or AMN, primarily affects adults and progresses more slowly, mainly impacting the spinal cord. Addison's disease, or adrenal insufficiency, can be the initial presentation in some individuals with ALD, even before neurological symptoms appear. Finally, some individuals who carry the ALD gene never develop symptoms, although they remain carriers who can pass the gene to their children. The treatment and management of ALD depend on the specific form of the disease and the severity of symptoms. For childhood cerebral ALD, hematopoietic stem cell transplantation, or bone marrow transplant, is the most effective treatment if performed early in the disease course, before significant brain damage has occurred. This procedure aims to replace the patient's defective bone marrow cells with healthy cells that can produce functional ALDP. Gene therapy is also an emerging treatment option for childhood cerebral ALD. Adrenal insufficiency is treated with hormone replacement therapy, typically with corticosteroids like hydrocortisone. Physical therapy, occupational therapy, and speech therapy can help manage neurological symptoms and improve quality of life. Lorenzo's oil, a dietary therapy, may help lower VLCFA levels, but its effectiveness in halting disease progression is limited. Currently, there is no known way to completely prevent ALD, as it is a genetic disorder. However, genetic counseling is crucial for families with a history of ALD. Genetic testing can identify carriers of the ABCD1 gene, allowing them to make informed decisions about family planning. Newborn screening for ALD has been implemented in several regions, enabling early detection and intervention before irreversible brain damage occurs. The prognosis for individuals with ALD varies widely depending on the form of the disease and the timing of diagnosis and treatment. Childhood cerebral ALD can be rapidly progressive and fatal if left untreated. Early hematopoietic stem cell transplantation or gene therapy can significantly improve outcomes, potentially halting disease progression. Adrenomyeloneuropathy progresses more slowly, but it can still lead to significant disability over time. Adrenal insufficiency can be effectively managed with hormone replacement therapy. Research into new treatments for ALD is ongoing. Gene therapy holds promise for correcting the underlying genetic defect. Studies are also investigating new medications to reduce VLCF levels and protect the brain from damage. Early diagnosis and access to appropriate treatment are critical for improving the lives of individuals with ALD.